Hello, my name is Dr. Charles Durr, and I want to talk to you today about peripheral neuropathy. Now, what is peripheral neuropathy? Now, it literally means death of a peripheral nerve, a nerve that is from the spinal cord level out to the rest of the body. It supplies all the muscles and tissues and organs and so forth. It detects information, sending it back to the brain, and it sends information from the brain back out to the body. Now, what are the symptoms of peripheral neuropathy? Now, typically you'll see numbness, tingling, burning, itching, a dead feeling. Sometimes it can be a sharp pain, sometimes it can be cold or heat, but the variety of times it's mostly numbness, tingling, and a lack of sensation in the early stages. And in extreme cases it can lead to muscle wasting and drop foot and paralysis and things along those lines. Now, what are the causes of peripheral neuropathy? Now, there are many. There's mechanical causes, there's metabolic causes, there's neurological causes, but the underlying factor is lack of oxygen to the nerve, or a lack of glucose to the nerve, and that's called anoxia or oxidative phosphorylation. Now, the metabolic causes of peripheral neuropathy are many. One of them, the leading causes, is a statin drug. Now, statin drugs deplete your coenzyme Q10, which at the cellular level is important for the production of ATP. So if your body can't produce these cellular regenerative enzymes, then there's a lack of oxygen, there's a lack of growth, and the nerve begins to wither. Now, some other metabolic causes of this are sometimes what's called hypochlorhydria, which means a decrease in stomach acid, and frequently caused by antacids or just the aging process and poor health. But what happens is you lack the nutrients and B vitamins and so forth to have adequate hemoglobin hematocrit numbers, and your body's ability to deliver oxygen to the body is decreased. So your oxygen saturation levels are below normal. Now, the peripheral nerves, and usually it's in the feet and the lower legs that we begin to see this, is the farthest distance from the heart. So obviously if you have a problem with carrying oxygen in your cells and your arteries aren't as efficient as they were, the body's capacity to carry oxygen and glucose down to the feet and so forth is compromised. So unfortunately, a lot of times we see what's called a subclinical anemia. And frequently, unfortunately, we'll see people with peripheral neuropathy who are often on a statin drug, they're often on a blood pressure drug, and they're often taking antacids. Now, the problem with blood pressure medication is that it may reduce the risk factor of having a stroke, but if you're having oxygen saturation problems, your saturations aren't as high as they should be, either due to anemias or some other factors, and your body tries to increase blood pressure to produce more oxygen delivery because you're not as efficient, and then you artificially decrease blood pressure, your oxygenation to your cells then will be suffering. And frequently that is an underlying cause of the peripheral neuropathy. Now, there are also mechanical causes: spinal stenosis, degenerative arthritis of the spine, bulging and herniated discs, pinched nerve and sciatica, all can be a cause of that. And they can physically compress the nerve, block the blood flow, block the oxygenation and glucose to the nerve. And if it's a mechanical cause, it's generally the most treatable. But what I found is generally most people have multiple causes: mechanical, metabolic, and neurological. Now, diabetics frequently have neuropathy because they have too much glucose in their bloodstream and it forces out oxygen. And so there's not enough oxygen getting into the cells. Obviously, it can't operate and it starts to die, literally. So the underlying cause of peripheral neuropathy is lack of oxygen, lack of glucose to the cells, to the nerve itself. And the nerve has its own specialized blood supply, and it has actually its own nerve supply. So it can monitor its own ability to keep track of its own oxygen and glucose. But when it becomes compressed, it frequently then cannot get the oxygen down to the deepest part of the cells in the feet and the lower legs. Now, there's also another mechanical cause called adverse neural tension. And this literally means that your nerves are being stretched or taut to the point where they have reduced their cross-frictional area. So if you imagine a Chinese finger torture, if you pull that finger toy apart, the cross-sectional area gets smaller. So if that nerve is actually being stretched, it becomes thinner and it's harder to get circulation in and out through the nerve. So these are just some of the most common causes of peripheral neuropathy. So our approach to treating peripheral neuropathy is both metabolic, neurological, and mechanical. So metabolically, we want to send you out for a complete blood work. We want to check for subclinical anemias, digestive or hypochlorhydria signs, blood sugar disorders, whether it be insulin resistance or hypoglycemia, or in fact if you do have diabetes. We want to look at the medications you're taking to check to see if you're taking a statin, to see if you're taking an antacid, see if you are taking a high blood pressure medication. And from there we will do a nutritional analysis of your blood work to recommend nutritional changes in your diet and lifestyle, and prescribe some specific nutrients and supplements to help you reduce the needs for statins, blood pressure, and antacid medications. We will then monitor your progress with repeated blood work and see how that part of the situation is going.